Well, welcome back at 7:14. This last week of February is National Eating Disorder Awareness Month, a time to raise awareness, recognize, support, and find ways to effectively treat eating disorders. With us this morning is Dr. Jennifer Creedon with LSU Health to explain the different types of eating disorders, how to spot signs. This is important for parents and caregivers, and treatment options out there. Doctor, good morning. Thank you for being with us to discuss this really difficult topic. First and foremost, I know some people at home may be thinking, I know what an eating disorder is, but they may not exactly understand. So give us the definition, if you will.
Right. So eating disorders is kind of an umbrella term for a variety, several different disorders, including anorexia nervosa, which involves restriction of eating, usually a significant amount of weight loss, although not always. Bulimia nervosa, which involves different forms of binging and purging, as well as things like binge eating disorders. And so really I think a lot of times we have a specific idea of what someone with an eating disorder looks like, and we think, oh, it's a teenage girl or a young girl, and they're super skinny. But in reality, eating disorders can affect all ages, all genders, all socioeconomic status, and can also present with, yes, very low body weight, but also normal and even above normal body weight.
And you were telling me, we were talking in the commercial break about how, in the past, again, teenage girls have been the group that people assume are dealing with this issue. And it was something you'd see in the 90s, in the early 2000s, but probably isn't too common right now. But you were telling me both of those things are false. In fact, you saw increases of eating disorders during COVID.
Right. So actually, we see eating disorders. In fact, some of the populations that have increased numbers are middle-aged and older women, as well as boys and men. And there has been increases in rates of eating disorders over COVID. We think that that's multifactorial. We don't fully understand why, but there have been more referrals to treatment, and kids are sicker when they get to treatment.
And you were also telling me, because of the ages range, the genders range, the body type ranges, what do you look out for if you have a child, if you have a friend who you think might not be properly caring for themselves?
Yeah, so that's a really good question. So I think looking for any changes in eating patterns, so maybe someone who used to go out to meals or would eat meals with the family who's now being more secretive or saying they already ate or eating alone. If you are seeing changes in body weight with kids, especially often when we get to summertime, and they're getting into clothes that are more show more of their body, that's oftentimes when you see the drastic change. And if you hear listen to what people are saying about their bodies or saying about food, and if you hear some of those like negative self-talk or negative things about weight or food, those are things you might want to explore more.
I know people at home are thinking, okay, I've seen these things, or I'm going to look out for these things now, but what do I do if I see it? Or I've seen it, what do I do now? And you were telling me we have great resources right here in New Orleans.
We do. So actually for children and adolescents up to 18, we have a clinic at Children's Hospital New Orleans, the Eating and Feeding Disorders Clinic, which has, it's an outpatient clinic that has therapy and a dietitian, and then we'll refer to specialists as needed. And that you can find that on Children's Hospital website, or the phone number is 504-896-8494.
And for people older than 18?
Older than 18, so I would start with talking to your primary care. The variety of outpatient mental health resources, including at UMC and at LSU Behavioral Science Center, and then River Oaks Hospital has an inpatient adult program for eating disorders specifically, and all of the information and referral needs are on the websites of those places.
So the good news is lots of resources out there, and now people kind of have the tools to look out for it and help each other.
Right, and to not, to try and take away some of the shame and isolation that comes with it and get help, because the sooner you get treatment, the better outcomes can be.
Well, doctor, thank you so much for your time this morning. We appreciate it.
Thank you so much.